updated post. Are we good? Try just a second here. We are good to go. So
Okay.
apologize for some of those technical difficulties, but Lynn's going to proceed with her presentation here this evening. So thank you.
Okay. And thank goodness there's folks here to handle the technology stuff. Okay, so we're talking about working towards a healthy weight, and the slides do not want to advance. Okay, let's try this again. There we go. So what is a healthy weight? Really, to figure that out, the easiest thing to do is just Google or otherwise search for a BMI chart. BMI stands for Body Mass Index. And you will find a chart that will tell you what is a good weight range for your height. And a BMI number between 18 and 25, technically 24.9, is considered to be a good healthy weight. 25 to 30 or 29.9 is considered overweight, and 30 or more is considered obese. Don't get terrified. It doesn't take much to get in the obese category, but just use that to help you figure out, sort of where you need to go. The good news is that even just losing 5 to 10% of your current weight is really beneficial for reducing your risk of recurrence of cancer, as well as easing up the pressure on your joints, your knees, your back, all that good stuff, helping to lower your blood sugar, lower your blood pressure, all that. So, you don't have to think about, I have to get to my ideal for it to make a difference. Every little bit that you lose will be very helpful. So, working towards a healthy weight is a three-pronged approach: healthy food intake, increased physical activity, and regular stress relief. We're going to talk about, what is a healthy food intake, but at this point, to mention paying attention to the foods you're eating and your portion sizes is the place to start. Very often we're not eating really because we're hungry. We might be tired, stressed, bored, thirsty, or the clock says it's time to eat. So tomorrow, every time before you eat, ask yourself, am I really hungry? And see what your answer is. It might be something else other than hunger. And so it's important to pay attention to, why you're eating. And then, of course, paying attention to portion sizes, how much you are actually eating. You don't want to think about this as a diet. You want to think about it as a healthy lifestyle that you're going to continue to work towards. We'll also talk about physical activity in a moment, but let's talk about stress relief at this point. Try to do something every day to help manage your stress. Find, what works for you, whether it's walking or other kind of physical activity is really kind of the best, because that sort of kills two birds with one stone, as they say. Meditation, yoga, humor, music, talking on the phone, whatever it is that really helps you to relax is very important. When we're stressed, we actually secrete hormones that make it easier to gain weight and harder to lose weight. And the weight that we gain when we're stressed tends to accumulate in the abdominal area, which is really the worst place to have excess weight as far as from a health standpoint is concerned. So let's talk about physical activity and adopting an active lifestyle. And why is this important? Well, just like during treatment, after treatment, having a good active day-to-day lifestyle will really help improve your energy level. Also helps to reduce stress, burn calories to control weight, and it's amazing what activity can do for your immune system. It's never too late to start being physically active, but do talk to your doctor or nurse practitioner about starting an exercise program and see if there are any restrictions or guidance that you might receive from your healthcare practitioner. So the amount of activity that we need to really get some good benefit is at least 30 to 45 minutes of moderate to vigorous physical activity, 5 or more days of the week. So, if you're not currently active, that might sound like a lot. So, start slowly, even 5 minutes at a time to do that consistently. Work up to 10 minutes, just a little bit at a time. Every bit does help. And then that gives you the time frame to be working towards and how many days a week in terms of what is moderate activity is walking briskly but that you're still able to talk. Any activity that you enjoy is good. Biking, dancing, anything that increases your heart rate, gets all your muscle groups moving, is what will count. So it doesn't have to be, torturous exercise. It could and would be ideal if it was something that you really enjoyed. If you are trying to lose weight, really trying to get closer to 60 minutes a day is what is going to help you the most. And trying to get the intensity up to at least moderate or maybe even a little bit higher intensity level, and still about 5 days a week. And it's okay to split up your activity into 20-minute chunks of time. It doesn't have to be the whole hour all at once. You might consider some strength training, like with some weights or resistance bands to help maintain bone health and regain any muscle that you may have lost during treatment. Um, Check with your doctor to see if you do have any restrictions before starting any physical activity, and of course, follow their guidance. Strength training 2 to 3 times a week, the day in between to rest muscles, is considered to be adequate. All right. And some easy ways to be more active, anything that you can kind of work into your daily routine, can add up and really make a difference. Use part of your lunch break for taking a walk, using a stationary bike or treadmill or elliptical or whatever while you're watching TV, spending time outside playing with your kids. The little tips that you may have heard before, like parking further away from the door of the store or wherever you're going, taking stairs instead of the elevator, all those things really can add up. Walk your dog every day. If you don't have a dog, maybe you can borrow the neighbor's dog. Okay, so let's get to eating a healthy diet. Really, the key thing in the cancer world of nutrition is to eat a mostly plant-based diet. And fortunately, this is getting to be a popular thing for many reasons. So there's a lot of information on there about eating primarily plant foods. And so we mean vegetables, fruits, beans and peas, nuts, whole grains, really trying to make the bulk of your food intake come from these categories. Not everybody has to become a vegetarian or a vegan, but if you don't mind that, there could be some benefits there. And we'll talk about fitting in some animal foods, since most of us have been brought up on a omnivorous diet, you might say. Aiming for at least 5 to 7 servings of vegetables and fruits per day is really important to get all the good cancer fighting chemicals that are found in plant foods. And, if you're not a big fan of vegetables and fruits, that might sound like a lot, but really, if you look at the portion sizes that count as a serving, they're really not large at all. A small to medium sized piece of fruit counts as a serving. A half a cup of cooked or cut up fruit or vegetables counts as a serving. So, if you have green beans for dinner and you have a 1 cup portion, that already counts as 2 servings. So, half cup cooked, cut up, kind of that standard. If it is dried fruit, it's more like a quarter of a cup. If it's something what I call light and fluffy, like the leafy greens, then it would be a 1 cup portion to make a serving. And it is certainly okay to use all fresh, frozen, canned, all dried, all the different varieties of ways to get in fruits and vegetables. Fresh and frozen are definitely considered to be nutritionally equivalent, and canned is definitely better than none. Um, 100% fruit or vegetable juices can count as well, and the portion size there would be 6 ounces. Whole grains are also an important part of a healthy plant based diet. And so we're talking about things that would say whole grain on the label. And it can be a little tricky to read labels and find that, but the very first ingredient in the ingredient listing should say, you know, 100% whole wheat or whole oats or whole corn or whatever it is. A serving size to count for a grain serving is a slice of 100% whole grain bread, half of a whole grain bagel, English muffin, or roll or bun, something like that. 1 ounce of a ready to eat whole grain cereal, or half a cup of cooked brown rice, whole grain pasta, regular oatmeal, things of that nature. So, as I mentioned earlier, vegetarian certainly can be very healthful if well planned, but including some fish or poultry, a small amount of lean red meat can certainly be part of a healthy diet as well. Most of us who were raised on a meat based diet could probably stand to reduce how often and how much we eat meat, but we don't have to eliminate red meat entirely. But look to try to decrease your portion size a bit, aiming for about a 3 ounce portion. And a 3 ounce portion is about the size of a deck of playing cards or the palm of a woman's hand. So less red meat is better, but it doesn't need to be avoided entirely. The big one really is avoiding processed meats, and any meat that stays pink or red after it's been cooked is considered a processed meat. Um, Things that contain nitrites and nitrates. These are the things that really have a pretty strong connection to cancer, particularly stomach cancer and colon cancer. But all the way around, trying to limit the processed meats is really important. That's the saddest news that I have for you tonight. Everything else is good news. Um, and should you decide to try a vegan diet after your treatment is done, we wouldn't recommend it during treatment. There are some important nutrients of concern. So make sure that you talk to your doctor or your dietitian to get information on how to do that properly. All right. We do want to limit intake of refined or white flour products, the junk foods that we know are in the snack food aisle, sweets, foods with lots of sugar. That idea of empty calories is important to recognize and know that we're just getting calories without the necessary nutrients that we need to be healthy. Um, the right kinds of fats can make a big difference in your diet. Olive oil certainly has stood the test of time, still at the top of the list. Therefore, also olives, nuts, nut butters, and avocado are all the really healthiest kind of fats for us to consume. Cold water fish has some really important specific fats in it that we call omega-3 fatty acids. And we should try to aim to eat fish or seafood about twice a week. If you really just hate fish and are never going to incorporate that into your diet, you might want to ask your doctor if an omega-3 um, supplement would be suitable for you. But to know that omega-3s in high doses can thin your blood slightly, so that you would want to stop that at least a couple of weeks before having any kind of surgery or other procedure done. And on to alcohol. The amount to limit alcohol intake too is listed here, not more than 2 drinks a day for men or 1 drink a day for women. And you've got the portion sizes there. I think it's really important to realize that alcohol has a pretty strong connection to cancer, certainly for cancers of the mouth, esophagus, pharynx, larynx, and liver. Pretty strong connection there. And also, there's a pretty significant connection with alcohol intake and breast cancer. So, the cancer risk increases with the amount of alcohol consumed. For this reason, you definitely don't want to exceed these amounts and portions listed here. And for those wine lovers out there, remember 5 ounces of wine is just a little bit over a half a cup. And many of us have wine glasses that are kind of bigger than that. So do pay attention there. And so a lot of times people then end up asking, well, I thought a glass of wine each day is good for me. And there are certain populations where the cardiovascular benefits may outweigh the risks of cancer. But you really need to talk to your doctor to figure out, where you lie in the risk spectrum. I'm guessing that maybe if you're listening to this, you're already living in the cancer world, and therefore maybe avoiding alcohol or really limiting it may be your best option. Okay, so all sorts of different questions come up about cancer nutrition. We hear a lot of it in the news every day, and it can be very confusing and conflicting. And so we just want to make sure that you don't change your diet based on one news story that you've heard. We really need to look at the preponderance of evidence to see what is best.
Lynn, thank you for this feedback. It's been great to have you both here with us this evening. A couple questions we've received. What causes taste changes during cancer treatment? Kathy, I think you touched on this a little bit. And is there anything that they can do to help improve taste during cancer treatment?
The tips that Kathy went over really are the key things. One of the things that patients say helps the most is that idea of rinsing your mouth before you eat. And it could be rinsing with salt water, plain water, lemon and water, whatever really feels refreshing to you can give you, at least 10, 15, 20 minutes of foods tasting better. It might not last long, so you'll probably have to do it before each time you eat, but do experiment. If your mouth isn't sore and you're not nauseous, you may actually need more seasoning in your food, and that's kind of a surprise to people who think that they should just be eating a bland diet.
And then next question, should I only eat organic foods?
Okay.
Does that make a big difference?
Right. So that definitely comes up often. So organic foods, meaning that it's either grown without any pesticides or it's not genetically modified, that animals are not given any antibiotics, hormones, that kind of thing. The media would definitely have you believe that it's going to make a big difference. We don't really have the research to support that as of yet. If you choose to eat organic and that fits in for you, that's great. If you can't afford organic fruits and vegetables, don't worry about it, because we do know that eating even conventionally grown fruits and vegetables can make a difference in our overall health and risk of cancer and all that. There are those lists out there that you may have heard of, the Dirty Dozen and the Clean 15. If you haven't heard of them, Google them. They'll come up right away. And those are the 12 fruits and vegetables in the Dirty Dozen that have the highest pesticide residue, so that if you are going to try to incorporate some organic, those are the ones to focus on. Clean 15 have the lowest pesticide residue, so you're not really getting as much bang for your buck buying organic off the Clean 15 list.
Great, thank you. Just a couple more questions. Is it okay to consume soy in your diet while you're in cancer?
Yeah, that is a big one, and mostly relates to breast cancer, where breast cancers are divided into a bunch of different categories, one in particular being whether it is estrogen positive or not. And so soy foods are really potentially a very important nutrition addition to your diet, good source of protein, good alternative to meat. So, and soy contains all sorts of phytochemicals that are good for us. But the key is to eat whole soy foods. So we're talking about soybeans themselves, the green, young, immature soybeans called edamame, tofu, soy milk, things that are made from the whole soybean are considered safe. And even for women with estrogen positive breast cancer, up to 3 servings a day is considered perfectly safe. Some researchers would argue that it's really helpful and protective. So, whole soy foods, good. Foods that contain soy protein isolate. So, when they take the protein out of the soybean, and just concentrate that into a food, a powder, a pill, whatever, that we really are not so sure about the safety of. So avoiding soy supplements would be the safest way to go.
Great, great. 2 more questions.
Okay.
Should I take a vitamin or an herbal supplement during treatment?
Okay. So herbs, the starting answer is no. You really need to check with your doctor. Both Kathy and I have the ability to check for potential interactions of supplements with chemotherapy drugs through a database that we have access to through our oncology nutrition group. So anything other than a basic vitamin or mineral, you definitely need to check. With basic vitamins and minerals, if you do decide that, you want to talk to your doctor about it, you think you're not getting enough in your diet, up to 100% of recommended amounts might be okay, but not the high dose, high potency, mega, ultra, whatever. Definitely not safe and may, in fact, interfere with your treatment potentially. So that would not be a good thing at all. And remember that supplements are not regulated. So really kind of taken some chances there.
Mhm.
So ask for more information. There's lots more information available.
Absolutely, great. And the last question is just about the nutrition program here at Riverside Cancer Center. So,
Okay.
can you talk a little bit about how you work with patients and help them with maybe specialized diets and that sort of thing? So that'd be
Sure.
great.
Right. So, Kathy and I are 2 of 3 outpatient oncology certified dietitians that work with Riverside chemotherapy, medical oncology, and radiation therapy or radiation oncology. And we are available to you. You just have to ask. Before COVID, we were in the offices regularly. Now that's sort of changed a little bit. So just ask to speak with the dietitian, your doctor, your nurse practitioner, the person at the front desk, whomever, just ask and they will get you in touch with us. And we will either meet with you or talk on the phone or get you the information you need in whatever way is best for you.
Thank you. Thank you both for joining us this evening. We appreciate your time. Um, as you continue to view these presentations, if you have questions, please let us know and we'll touch base with both Kathy and Lynn to get those answered for you. And we appreciate you joining us here this evening. Thank you so much.